Hey, so this is a video for both the chiropractors and the chiropractic assistants.
Mm-hmm.
What we're talking about in terms of retention is the handoff. The handoff is important because that communication that the chiropractor has with the chiropractic assistant drives those patients into obviously their schedule of care. It could be driving them for a financial discussion.
Mm-hmm.
It could be basically making sure that the patients are fulfilling what you think is best for them. All too often what happens is if I don't come out, the patient might say something completely different.
That's right.
So at the end of the day, anyway, there are going to be instances where the chiropractor has to push it to the CA, and there'll be instances where the CA pushes it to the chiro. So here are the most common instances that we would have to do a handoff. Well, when I say have to, you have to do a handoff.
Yeah, because it helps to really land where you're driving this.
Absolutely.
Yeah.
There are times where you can choose to do it. We'll talk about that as well. All right.
Cool.
So the first obvious one is when we're handing off after we see that patient as a new patient.
Mm-hmm.
So you take the person out to the front desk and you say, "Hey Nita, this is Mary." Well, you've already met Mary, but hey, Mary needs to get some x-rays. Can you get her booked in ASAP, please? Can you tell her where to go, what to do, and you can drive from there.
That's right.
Okay. If there's any instances from this point of view, let's say for example Mary can't get in, let's say you might have to ask, look, can Dr. Andrew, would you mind staying back late on Thursday night because
That's right.
Mary can't come in for 2 weeks otherwise?
Right.
Then that would be a flip side. Okay. And then that way we drive. Nita would say, "Hey Mary, what day, when can you get those x-rays? Can you get those x-rays done tomorrow? Can you get those x-rays done tomorrow or the next day? Great, I can see you, or we can see you this time or that time." Or it might be, let's book you in for Friday. Can you get the x-rays done before Friday?
Yeah.
So there's a few scenarios there, but we want to try and make sure that we're giving them choices, and both of those choices
Are the options that we want.
yeah, exactly.
Basically.
Yeah. Don't ask them how long will it be till you can get those x-rays.
Yeah.
Okay. So that's important. All right. The next one that we would have would be the report of findings. So after we sit down, we explain what's going on.
Video or just talk, but
No, we can do it all together.
Yeah,
Yep.
cool.
So the report of findings, we will basically be giving them their schedule of care. We'll have they've received their first treatment, and at the end of that, obviously, I'm going to walk the patient out to the front desk. Usually, I'll communicate with them and just say, "Hey, look, what we really recommend is that you go for a nice long walk after your adjustments. If you feel any soreness, either give us a call or use an ice pack." And drink lots of water. Dehydration is really a key factor with trying to make you heal. But the handoff will be to the front desk. It'll be, "Hey Nita, Mary received an adjustment today. I've given her schedule of care. Can you book her in, please?"
Yeah.
It doesn't have to be bigger than that, unless there's maybe an objection in this room that I need to pass on to Nita.
Right,
Anything
but I
else?
also think it's important to be very detailed about their schedule as well. And also to be like, we want to see Mary twice a week for X amount of weeks, just so that Mary knows that Andrew is on board and I'm on board. That way we're all on the same
That's
page
a really
as well.
good,
So
really good
we
point.
really want to drive the schedule of care
Exactly.
from the get-go.
Yeah, so Nita, Mary's 3 times a week for 2 weeks, twice a week for 6 weeks. Can you book those in advance,
Yeah.
please?
That way, Mary can't say, "Oh, I'm only going to be in once a week." Do you know what I mean? That way,
Perfect.
that she can't deviate between
They
the
do
two
that.
of us, because
They do that.
we really want to stick together.
We
on
could
this.
go one step more and we could be more specific, and you could say, "So Mary, what days of the week suits you best while I'm there as well?" Okay? So there's a few little things that we can go from that there. All right? And we'll role play that one-on-one, but this is the most important part of it. Okay? Next one. Now, occasionally we won't have to do this, but the CA report or the third visit,
Yep.
there might have to be a handoff at the end. It may be a handoff from the CA to the chiro. In other words, let's say Nita was taking the patient through the routine and they bring up that, "I've spoken to my husband and I don't know if I can do the care plan." All right. So when I come into the room, Nita will make sure that, and remember, this is always in front of the patient. So Nita will say, "Hey Andrew, Mary's really, really keen to do chiropractic care. However, she's just brought up a problem, possibly. Can you work out a solution she can't do twice a week for 6 weeks?"
Sorry.
Yeah. Maybe you've worked out the solution, maybe you haven't. that's our job as the chiropractor to handle that objection as we go along. And we'll do training on these objections, but it's just the handoff for that, because Nita doesn't tell me, I don't know, I have an assumption that everything's okay unless till proven otherwise.
Yeah.
Okay. Anything else on that one?
No, I think it's just being clear. The communication is everything.
Crystal clear.
Yeah.
Yep. Cool. All right. So the next one is the wellness visit. Now the wellness visit's on visit 6 and 18. All right. It's basically the halfway point between examinations. We tend to find that as people go along in their care, they start to get a little bit they start to get relief. The focus, I suppose, of being and doing what we're doing here tends to get a little bit less, and we're just checking in. It's an emotional visit as well.
Yeah.
We'll go through the script of that soon, but there may or may not be something that we need to actually tell the CA at this particular appointment there. So if there's nothing to tell, then the CA can just assume that it's all okay.
Yeah.
This is a maybe one. Okay. Now the next one, and actually the next two, I dare say, the most important in terms of your retention of your patients. So it's the handoff after we do the first progress report and the handoff after the comparative report. So an example would be, hey Nita, we've done a progress report on Adam today. Adam's doing really, really well. We're going to maintain his schedule of care. So the next phase of his care is once a week for 12 sessions, and then we'll re-x-ray him at the end of those sessions.
Yeah, so you're always bringing Adam out of the room and to the reception.
Yep.
To make that communication.
Yes, and on their little form, we should actually write what their schedule is, just in case we forget what we told them, all right? And if it's not there, it's your job to say, hey Andrew,
That's right.
write it down, or if you didn't write it down at the end of the shift when we post goal from the end of the shift, we write down, you forgot to write that down, can you do that please, Andrew?
But we're always trying to communicate it in front of the patient, because the patient always looks forward to their report as well, because they want to know what their results are.
Absolutely.
That's why they're coming, that's why they're here.
And we can use it in I hate to say this, but a negative way and a positive way also, right? So let's say somebody has missed some appointments, all right? So I'll say to Nita, hey Nita, we've just done a reassessment. Unfortunately, Peter was away for 2 weeks, so he's missed out on 2 weeks of that care. So we're behind 2 weeks.
Yeah.
So can we continue care for another 2 weeks at twice a week and then push him out to that? Or we might want to pat him on the back and say, look, Peter's actually done really, really well.
Yeah.
We're going to push his schedule of care shorter. So instead of being another 3 weeks at twice a week, we're going to actually now push him out to once a week from then onwards there. And it is our job as a chiropractor to handle whether they're on schedule or off schedule, and not be shy and tell them why they're above ahead or behind schedule there. Call them on their bullshit. They haven't been doing exercises, so you're behind on your care, you know? So let's continue this next part. Is there any reasons why you're not going to be able to do your exercises? And obviously with a comparative exam, we're doing x-rays.
Yeah.
So you need to, once again, pat them on the back and say, look, Adam's doing fantastic. He got really good results, Nita. You've got to check those results. They're great. They'll take a little bit of pride out of it, and then they'll go into the next stage there. Okay, and be really clear, face to face, but also in front of the reception as to Peter's still fixing his problem, or Peter's decided not to fix his problem in front of Nita, so she's crystal clear as well. All right, cool. Next one, prior to traction. So there's two parts where we talk on this one, all right? So obviously, Nita will tell the patient that they're gonna start their first traction, all right? But it's that communication that Nita pops her head in and just says, hey, Dr. Andrew, Phil's starting his traction today.
Yeah.
All right? Or I'll pop my head out at the end of it and say, hey Nita, we just did setups today, so there's no charge for traction today. And then she can say, oh, just did setups today, we charge only when you start to have proper traction.
Which the price for traction will always be spoken about at the CA.
Yeah.
So we always call it the first half and then starting the second half of their care when they come into traction. So that really is, the first part of their care is really just getting them into a routine of chiropractic, and then traction is coming into the second part of their care where they're really going full bolt into rehab, which is also communicated beforehand.
And I guess it's a financial thing, but it's also uplifting thing. They know that they're improving and they're moving to the next level.
That's right.
All right, and I guess you future pace with people at that particular point. You say, how exciting,
That's right.
Yeah, okay. Another one would be after you give somebody products. Hey Nita, we've given Peter a Denerol today. Would you mind sending him a video? That's all it needs to be. Also, it's for her point of view, it's going to be that she remembers to charge him for that. Okay.
Yes.
But also in the respect that they know that we're onto it, so on and so forth. It could be pillows, could be any product that you have. You want to communicate that with them. This is a really big one. After a long visit, let's say for example, we have somebody who has not been in for quite some time and they've told us that they just need an adjustment. Let's say for example, it's 3 months and they're a regular patient, but they're not really regular, if that makes sense. But you had to spend quite a long time with them. Let's say, for example, you're running late because of it. You basically, when you get out to the front desk, you just say, now, Nita, that's a long visit today. Okay? And she just charges them a long visit fee. Simple as that. They then know that they need to tell us there's a long visit, or they need to know to maybe have chiropractic care a little bit more frequently to avoid that extra cost.
That's right.
All right. That's respecting our time. And of course, there are other circumstances where maybe Nita might have to pull them aside and say, hey, when you're really bad like you were today, can you let us know, because I didn't allow enough time for you and we run behind. So all you need to do is just say, I need a long visit today and future, and then we know how to book it in from there. Okay. So they're the main ones from the chiro to the CA, and then of course we talked a little bit about the CA to the chiro. So an example of common things that we would have a loss of communication in the opposite way will be if somebody can't afford chiropractic care, if they're stopping chiropractic care, maybe they missed an appointment, and it's really important that the CA lets the chiropractor know in front of the patient for me to handle it, basically. All right. So an example would be, hey Andrew, if you remember, Phil's been away for 2 weeks. Can you just double check to see where he is in his care? Or it might be, hey Dr. Andrew, Phil just has a question about his care program. He can't make it in because of work twice a week. Can you guys organise something to work that out so he still gets the results that he really wants? And of course, there'd be the final financial one. Hey Andrew, Phil's stopping chiropractic care today because he can't afford it. Can you have a chat to him and see if there's anything you can work out? All right, it's just a seed, and we just handle it. Most of the time, I'll just say, "Oh, it's really sorry to hear that." And we'll go through those objections at another point. We were just talking before. This is not a big one, but when you think about it, it could be a really big one for your business. Let's say, for example, Nita's chatting to one of the people out there, and they're asking about somebody else who might need chiropractic care. It's just a little seed that Nita can just pop her head in and say, hey Andrew, I was just chatting to Mary, her husband has headaches. Can you tell her how chiropractic can help headaches? All right. So, as I said, we'll role play all these stuff. We're about to go do that now. If you have any questions with any of these, definitely write them down and either shoot me an SMS
and subscribe.
Or email. You could do that as well. Yeah, all right. And role play. Okay?
That's it from us.